Hello, today we'll be talking about the case of Prader-Willi Syndrome by me and Sahana.
Prader-Willi syndrome is simply the deletion of the father's 15th chromosome, which is passed on to the child. Symptoms include intellectual impairment, obesity, short stature, and compulsive behavior. As you can see on the right, obesity is one of the side effects. This disease is considered as autosomal dominant, meaning only one chromosome is needed for the child to receive this disorder.
As you can see in the picture on the left, this shows the transferring of the chromosome 15 from both the father and the mother. As you can see from the father, it is transferred down as the blue, and the mother is transferred down as the pink. And as you can see at the PWS critical region, it is blue at the father, but for the children it's red, so that means it's affected. Meanwhile, if you go onto the next picture on the right, this is a more in-depth version. So you can see in this part, this pinkish area right here is where the part of the chromosome breaks and it's therefore becoming deleted, so it makes the chromosome smaller.
This photo shows the pedigree for this situation. Because it is a random event, both the mother and father are unaffected by this disorder. They both have normal 15th chromosomes. However, during reproduction and meiosis, the father's 15th chromosome has a deletion, and this chromosome is passed on to the child, which makes it autosomal dominant because the child only has one chromosome that is ineffective.
As you can see in this karyotype, if you look at the 15th number and you see the left chromosome, you can see that it's kind of longer than the right because the right has that deletion of the genetic material.
The first question is, what is the life expectancy? Well, the life expectancy can be normal if it is managed both medically and psychologically. This includes hormone treatments and symptom accommodations, and we'll get into these more later on.
For the second question, we have, can our child reproduce? Well, the thing is, people with Prader-Willi syndrome are unable to reproduce because their sex organs tend to be very small, so they're unable to do so.
The next question parents may have is this something that will affect our future children? Well, no, because this is a random event that occurs from reproduction and meiosis, and it is not in the parent's body cells. However, there is a chance that more problems like this can occur because of the parent's age. The mother is 44, which is old for a woman.
So, these are some of the recommendations that people with Prader-Willi syndrome should take in precaution.
The first recommendation we have is therapy, and this is because people with Prader-Willi syndrome have short tempers and are irritable, and going to a therapist can help manage this.
For the second thing, we have human growth hormone, HGH treatment. This is basically a treatment that allows the growth of hormones and also allows the bones and muscles to grow, allowing them to prevent them from being obese and also short.
The next recommendation we have is sex hormone treatment. This treatment basically helps the individual's sex organs develop more in order for them to reproduce and have a greater chance of reproducing.
The next recommendation we have is for the mother primarily to stop having children because of her old age. She is currently 44, and having children at this age would inhibit more risks of bad diseases and syndromes, more prone to all of these.
The next recommendation we have is for the individual to maintain a healthy diet. This is kind of a given, but because of the circumstances of obesity, this would be extremely helpful for them.
And for the next one, this one is also a given, which is to engage in regular daily activity. By doing this, they're able to prevent from being more obese than they are actually.
The last recommendation is for the parents to learn about the syndrome itself and teach their child about the syndrome so that they can eventually accept it and live a long, happy life.
Thank you.
Thank you.